So our next speaker, another great Ayurvedic scholar from India, is Dr. Vaidyaraj Sunil B. Patil. He is the founder and president of Vanushati Vidyapith in Kolhapur, India. And he is the editor of Vanushati magazine and author of 8 books on Ayurveda, and he is the recipient of numerous national and international awards, and he will be speaking to us on medical management of surgical indications and Ayurvedic approach. Please welcome Dr. Sunil Patil.
Sarvepi sukhinah santu, sarve santu niramayah, sarve bhadrani pashyantu, ma kaschit dukkha bhag bhavet. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwaraha. Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. Om Shanti Shanti Shanti. Chairperson of the session, Dr. Patil, co-chairperson, and Rishis of modern scientific age, Dr. John Heglin, Robert Keith Wallace, Bevan Morris, all assembly of Rajas and ministers, Honorable Anandji, Dr. Robert Schneider, my brotherly Branko Cicic, and all delegates who came from long distance from India, and friends in Europe, America, and all over globe. Today, this is my proud privilege that I am here to share my views with you. So today I am going to speak because since last 2 days we are listening many fundamentals of Ayurveda and therapeutics of Ayurveda and academics and this and that. But now today I am going to present my work of 30 years in a nutshell, and the title of my presentation is Medical Management for Surgical Indication. So this is a holy tradition, and we would like to say Jai Gurudev to everybody. And this is Gurudev, whose divinity bless us. I remember the date in the year 1992, and month was August. I first met and I first saw Maharshiji. I was selected as a young Vaidya, and I was trained in Maharshi Ayurveda in Maharshi Nagar, New Delhi. And then I asked to come here in Flodorf. I spent 3 months here, and I learned a lot with here at the tapes of Maharshiji. Even I spent 8 hours, 10 hours, 12 hours continuous meetings on reviving the courses of Ayurveda. And in those days, we junior Vaidyas sit together during our free time and we discuss, what is this? And is it possible that Ayurveda will become a mainstream medicine in the world? And during the discussions, during the meetings of Maharshiji, it was, I remember that Dr. John Heglin was our candidate, presidential candidate of US. And at that time, yes, he contested the presidentship there. And then Bill Clinton was elected, and Hillary Clinton declared that naturopathy would be given more importance and freedom in US. So during the meeting, somebody informed Maharshiji that this is the right way, right time to introduce Ayurveda as a naturopathy. So let us try, and we could have a legality in US. So I remember continuously what Maharshi says on that day. Maharshi quote that, may it will take hundreds years to go get legality in US for Ayurveda, we shall wait, but we don't use any other therapy as an Ayurveda. So this was the vision of Maharshiji, and today what we thought that it is a mirage, it is a just dream that Maharshi Ayurveda will become a mainstream medicine in Europe and in, globally. But that was not a mirage. That was a word of Maharshiji. And after 25 years, today, we realize, since last 2 days, continuously I'm realizing as a humble grassroots level worker of Ayurveda, I realize that the day is coming and Ayurveda will be the most prominent medicine of the world. When I leave floater off for US, and on that day Maharshiji, it is a custom to meet Maharshiji, and Maharshiji told me that go there in America and hoist the flag of Ayurveda. Those words I still remember, and the river of Ganges moving fast, flooded with knowledge. The Maharshi Ayurveda, flooded with knowledge, is going towards the humanity and towards the health field, and nobody will going to stop that now. It's my view. So proceed Ayurveda. Since 2 days we are dealing with the science of life, but surgery is the one-eighth part of Ayurveda, and Sushruta is a pioneer of that surgery. Modern definition is that what is surgery, and this is a Sushruta. There is a possibility many times when a patient comes to surgeon for a general surgery, and many times the patient is not ready, the relatives are not ready to have surgery. Then sometimes anesthetical problem is there, and patient is not fit for surgery. So in such a conditions, there are many medical conditions like rhinitis, sinusitis, tonsillitis, deviated nasal septum, renal colic, renal calculi, cyst, small cyst, gallstones, then prostatism and spondylitis, hemorrhoids, gynecological disorders like cysts and other problems, uterine fibroid, etc. So whether can we help for these surgical, these are the clear-cut surgical indications. So in these conditions, can we help patient with medical management? So in that area, I have done my research, and continuously I am dealing with such patients. Tatra dhanvantariyanam adhikar. Even in Ayurvedic text, it is stated, clear-cut stated that don't go in the field of others. If you are practicing medicine, you practice medicine, don't deal with the surgical patients. But in such conditions, if the condition arises, then we can able to treat such patients. There is one case. This is a young boy, age 15. He was having jaundice, and then he developed hepatomegaly along with enlarged periportal node. So you can imagine, this was the only son of his parents, and it was a termoid condition that the surgeon said that we should go for surgery. Medicine doctor, they said that it seems that tuberculosis, we can go for anti-cox treatments. And so many opinions were there. They go here and there, they go in institutes here and there. And finally, somebody refer that patient to me. And they come from Pune to Kolhapur. And I saw all the reports, and then I treat with herbal medicines. And after 3 months, you can see the first report of diagnostic report before treatment. The impression is mild hepatomegaly with enlarged periportal nodes and mild splenomegaly. After the treatment of 3 months, we have done again the sonography, and report reveal portal lymph nodes has completely resolved, no other abnormality detected. So this is a miracle for with the Ayurvedic herbal treatment, that patient subside the whole lymph node. And now that young boy is working as an engineer in United States. He is in New York. There is a second case. one lady of 26 years and acute right hypochondriac pain, and she was delivered a baby, and it was a cesarean section, and after 15 days she got pain, and it was an unbearable pain. They went to hospital, and the surgeon said that it is an emergency, and they did sonography, and they revealed that it is a gallstone, and they advised we should go for surgery, otherwise it is life-threatening. But the parents thought that she had just gone by a cesarean section, and the baby's breastfeeding is going on, and she's in a lactating phase. So we should wait for some time. And they refer few doctors in Pune, and they also opine that she should go undergo surgery, and she should remove her gallbladder with surgery. This was the report, and in that report shows that 1 to 2 millimeter diameter calculus are seen in the gallbladder. No sludge is seen. Gallbladder is not oriented, and the fat around, and even they stated that the gallbladder moderately thickened and suggestive of mild cholelithiasis. So, the relative of the patients come to Kolhapur. Somebody refer my name, and they come to my clinic, and the patient's brother-in-law was allopathic doctor. He was a modern medicine doctor, and he was started arguing with me. How is it possible? How come you can going to treat the patient, and what are the results? Have you tackled any patients such a patient in the past? So I say, please sit down. Patient is in Pune, you are here, and why we are arguing? And then he showed me that, you see, this is the drawing, our surgeon draw this drawing and advises here cut, he will going to cut here, and he remove the gallbladder. I say, my drawing is better than your surgeon. I will draw, let us see. Then I explained what is the condition, and I stress especially that gallbladder is an important organ of our body, and if possible, we can stay for some time. We can try. We should go for medicine, and if not possible, then you go for surgery. So then I give some medicine, and then patient talk with me on telephone, and then she come on the second day. She relieved the pain, and then she personally come to me. I did her pulse diagnosis, and then I start treatment. After 3 months, the patient and patient's husband, they both were come to my clinic, and they say that we are going to join our duties in Mumbai, and before that, here in Kolhapur, we should have sonography. Then I said, let us wait for some time. Then they insisted, no sir, we are going to Bombay, and it is impossible to come to us back immediately. Then let us go for sonography. Then I give the cheat, and they go for sonography. They came back with sweets that gallstone was revealed, gone. The report shows, ultrasound findings shows no significant abnormality. So within 3 months of treatment, all gallbladder stone were vanished. Case number 3 is a young lady, 31 years old. She had renal calculi, classical vomiting, fever, and other symptoms were there. And when we did USG, it shows that 10 into 7 mm calculi. And evidence of ultraviolet junction calculus of 10 into 7 mm giving rise to proximal hydroureter and mild hydronephrosis in left kidney, bilateral small tiny renal calculi. And they advise clinical correlation, please, also. Then we started herbal medicines, and then after 2 months, the USG finding shows, USG findings of KUB shows no significant abnormality. Then next case, this is a lady of 34 years. She is also complaining irregular menses and abdominal pain during menses and throughout the month. And when we did her ultrasound, it shows mild changes of hepatic fatty infiltration. But most important thing was bulky uterus and about 17 into 15 mm arising. This is a lesion, and it was small uterine fibroid. Then we start our herbal medicine, and after few days, few weeks, we did the follow-up study, and it shows normal USG. Only impression was bulky uterus. The fibroid was gone. In such a manner, many patients we have treated for renal calculi. This is also a case of renal calculi. So this is a most interesting case. In our city, the corporation started to rebuild the roads, and in the road accident, one patient had trauma on his left eye, and he got unilateral ptosis. And he came to me, and tragically, on the next day, he was supposed to join on a promotional post. But unfortunately, he cannot able to accept that post. And he referred to me, and then I treated him with Netrabasti, and the result was on the 14th day, he can able to open the eye. On 16th day, he joined his promotion. This is a most interesting case, last case, before ringing the bell. A young chap of 41 years, and he is a non-diabetic but non-smoker, non-alcoholic patient. And he had, so this is the case, 95% block. He has IHD and continuous chest pain, and then they diagnosed in hospital, and 95% block was there. Then we treated with Rudbasti and oral herbal treatment, and after 3.5 months, that has been resolved, totally resolved. So such a cases we can deal with in our hospital. This is the another case. So I did my practice with these thinkings of these guidance of Charak, which has been mentioned in Charak Samhita. Tasmad vikara pravrutti adhishthanaantarinach samuthana visheshasya budhva karma samachari. Budhva karma samachari is most important. You should diagnose with your intellect. Don't get frightened with the name, this and that, and big ITs and this and that. Don't worry. But you should diagnose the patient with your intellect. And that is why I am very much thankful to Holy Tradition and Maharshiji that I learned TM, and I am a regular meditator and Siddha. So I advise every Vaidya here that you should also learn TM and do regular practice of transcendental meditation, and certainly you will follow the thinkings of Charaka. So we treat with, these are the herbs. I am not going in details. These are the herbs. We prepare some herbal preparations, and we treat the patient with this. So I am going very fast. And these herbs are collected in deep forest, and this is Maharshi Ayurveda Gram we built recently, and there we collect the medicines, we make the stock, and we make formulary there. So my conclusion is that we can, if we can did diagnosis properly, and we deal with the patient, then we can avoid surgery in many cases, and patient will be happy. So this is my Panchakarma center, which is situated in Kolhapur, and it is 100% Vastu, and we treat their patients in patient department also. This is the center, and I am very much thankful to you for patients listening. Once again, I am thankful to all of you, and especially my regards to Girish ji, because his efforts since last couple of months, he is doing effortfully with his team, and especially Lotha Pig, Dr. Reinhard Peach, Dr. Walter Malk, and all other team members. I am very much grateful to them for such a beautiful event in land of flowers. Thank you. Jai Guru.
Congratulations for all your success, Dr. Patil. I wished he is inviting his secret herbal medicine, which we didn't understand as yet.